Dr. Mendoza's worldview is inherently optimistic. He believes in the dignity and promise of every individual. He lives that and he breathes that as a doctor treating patients, as a teacher teaching future leaders in healthcare, and as a leader of large national organizations.
When you get into leadership positions, the opportunity exists to make a difference. It doesn't have to be, we're going to change the world. But I think if you can make the people understand the world, then you have the opportunity for them to also partner with you to make that change.
Now all these people, they are in leadership roles and they're helping patients, they're promoting diversity within their own institutions. It's been kind of a ripple effect. I think it's very inspiring because that's ultimately what I want to do as well.
My father was a farm worker and met my mother when he was in Juarez, Mexico. They moved up here in 1947 and subsequently had me. I'm the oldest of 6. We lived for a while with my grandmother in her basement, and that was in the Gardner area of San Jose.
I think that growing up in that kind of a community and seeing the differences in terms of the traditional Mexican family and a white middle class community, it was just like, whoa.
I was in 5th grade and I was the only Mexican kid in that class. And my teacher asked a math question. I raised my hand and he said, "Fernando, put your hand down, you already know the answer." I tell students, that one word, that one statement, put your hand down, you know the answer, allowed me to feel like I was smart and I would be able to do anything.
He and I both grew up in the 60s, and that was a time when the inequities of social justice were so present in schools, on the television, in wars, politically. It sensitizes you to, geez, things have got to be better, and it's got to be our job to make society better.
I thought that being a pediatrician was the thing to do. When I started Stanford, I got a call from some of the Stanford medical students that were working in community health, and they said, "We're starting this clinic and it's in Gardner. Would you like to be part of the student group that does this?" It gave me a chance to see some of the needs of communities that had worked really hard to just survive and weren't getting good health care. It's nice to get health care, but if your health care is just going to the emergency room, that's not quality health care. Having the experience with Gardner, it ended up being, I need to understand public health more.
For 30 or 40 years, Dr. Mendoza has really contributed to the whole field of health disparities research generally. Dr. Mendoza has particularly focused on those disparities determined by ethnicity, particularly Hispanic ethnicity. It's really important as we recognize the demographic shifts in our country to a minority-majority nation to make sure that the healthcare leaders reflect that demographic shift.
If we look at by just social class, the upper 20% social class produces 80% of the doctors. So that means if you're not in the upper 20% in social class, you're very unlikely to become a doctor. We're trying to flip it around to make sure that we use everybody that is capable of being an outstanding physician, an outstanding scientist, an outstanding educator.
There's a lot of research showing that if there is cultural similarities between the medical provider and the patient, there's just better health outcomes. There's also been a lot of research looking at language concordance, so physicians speaking the same language as patients. Having done clinics myself, I feel that when I start to speak to them in Spanish, they just become, I guess their guard is a little bit lowered. they're more comfortable. I get more questions about their care.
In clinic, we'll ask our residents when they're presenting a case, well, where does this family live? Do they live in a home? Do they live in an apartment? Do they live in a garage? Do they have access to care on a regular basis? Are their kids, safe in their neighborhoods?
Dr. Mendoza taught me to listen. He taught me to listen to my fellow students, as well as to my patients, to really understand what their lives are like.
How does an institution embrace diversity and inclusion? Well, you have to have a curriculum. You have to have a climate. You have to have a student body. You have to have faculty.
In 1984, a year after I became a dean, we started the early matriculation program. And the real goal of that program is to think about how do we make minority students become faculty and leaders in medicine.
This was a program to say, we welcome you, we want you to grow, we want you to start right here, and we will support you.
I work directly with him through the diversity task force. Like him, I also believe that if we have more minorities in leadership roles, we can have a greater impact, because by our presence, it can make somebody believe that they can do it. They can pursue higher education, they can pursue medicine, they can pursue a PhD.
He also cares about diversity of thought and wanting to make sure that there's a diverse group of people who will be leading future systems of care to improve opportunities for young children throughout the U.S. And he lives that and breathes that here at Stanford, but also in many national organizations. He mentors not only folks like me, but people who are young up-and-coming faculty at other institutions around the country.
Work that I've done over the time has moved from health disparities to issues of immigrants. What we've done is linked our efforts in health with people that are doing policy work, and one of those is the Immigration Policy Lab. We did a piece recently that looked at the DACA issue.
In this article published in Science, they were able to show that the children of those DACA recipients were less likely to have mental health problems and seek care for mental health problems than children of immigrants who were not DACA recipients.
So what that really proved was the fact that policies that we make as a nation can have health impacts on kids. When Congress or states make policies that affect the parents, they're making policies that not just only affect the parents, they're making policies that affect you as kids.
He understands the dignity of each individual, and he helps us. He loves to help us see sometimes what we can't see within ourselves.
He's made an impact on so many people's lives, and he's mentored so many people that he just has this reputation of being a mentor and being supportive.
He helps us find meaning in our lives and in our calling, particularly in healthcare, that sometimes we didn't even see coming.